Good morning and a good day. Have a smiling day. I'm Khalid Iqbal Bhatt from Pakistan. I did my MBBS from Faisalabad and then I did my diploma in dermatology from Institute of Dermatology, Bangkok. And I stayed for more than 10 years in Juntendo University, Japan, where I did a doctorate in dermatology, a part of 30 international publications. It's a great honor with me to communicate with you all today and in future as well. Have a smiling day, and we'll be talking about one of the most common diseases of the children in many parts of the world, atopic dermatitis.
Okay, Dr. Khalid. So, what is atopic dermatitis and is it related to the presence of any antibodies?
Present?
Presence of any antibodies?
Presence of antibodies. When I see children, or you will see children, you will see a child who is scratching his legs, scratches his legs, scratching his flex areas. His redness, redness on the head as well. What is this redness? The mother will say he has redness for many weeks and it's not coming. When he's sleeping, he's scratching his whole body like anything. I try to give him antihistaminics, tell the mother to use cotton clothes, put some emollients like any soft, cheap emollient on his body when the children is taking a shower, and just dab the body dry, and then try to be comfortable with them, give cotton clothes to wear, and not hot environment to live in or sit in. The atmosphere should be cool. And I will think of two diseases. One is if he has a lot of scabs on his scalp and some of the parts of it scabbing, like a dandruff, we'll think of seborrheic dermatitis. But it is without that, all the body is cracked and the children are doing all this, I'll think of atopic dermatitis. I may think of doing IgE as well. It all depends on my chance.
It is an inflammatory disease, right?
It is an inflammatory disease, one of the most common diseases found in children. And then, if I'm able to find IgE, okay, good. If I'm unable to find IgE, no problem. I'll try to give sedative antihistaminic to the child at night and non-sedative in the morning. And tell the mother, do two things. Let the child scratch, no problem. Let him not scratch his nails. Just put a lot of grabbing on the nails.
All right,
And then I'll try to give him some topical steroids and the ointments together during the daytime. Of course, cotton clothes and avoidance of heat is a part of it. Yes, please, you're talking.
So, if a patient comes to you in the clinic with atopic dermatitis, what would you see in the patient? What clinical features would you see?
You see, I will see a child scratching all of his body, living to an affluent family or poor family. Some of the members of the family also has it, and scratching, itching, and oozing of blood and pint of blood from him. He may be having seen acute dermatitis in which he has to be admitted to hospital, subacute dermatitis, or chronic atopic dermatitis. So depending on the type of them, you have to use the situations. You can do K-Menopause solution on different parts of the body. You can use some steroid creams in combination with vitamin D cream, or you can use some antihistaminics as well. And then let you give assurance to the parents. They want to read anything, let them read from the country. Atopic dermatitis. They want to read from US, yes. They can read from UK, they can read from Australia, they can read from Japan as well.
Alright, so what about the complications of atopic dermatitis?
If the scratching is like acute dermatitis, the scratching will not go, the color will become bad, and the child becomes very ugly when he sees at his body. And if it is itching, but thick one, slowly going away, and then you will see like any fight area on the skin as well.